Now, there is some good news on the horizon. Doctors may be closer to having a coronavirus treatment. A new study out of China revealing positive results for the anti-malarial drug, hydroxychloroquine. Joining us now to explain more about this is our panel of medical experts. We have cardiologist and Pacemate CEO, Dr. Kevin Campbell, as well as founder of the New York City-based concierge medical practice Evolve Science, Dr. Erica Schwartz. Dr. Schwartz, let me start with you. From what you've seen so far, especially in New York, as far as the cases and deaths are concerned, what have you learned?
I've learned exactly what everybody's saying, is that pre-existing conditions, people who are obese, people whose immune systems are deficient, people who have not been practicing prevention are the ones who really get sicker. They're the ones who are more likely at risk. And they're the ones who are going to get into more trouble. I've also learned that there are a lot of ways we can prevent this. There are ways in which we wash our hands, we stay away from each other. The social isolation, keeping 6 feet apart, is really crucial. Staying home is crucial. Not interacting with other people is crucial. When this is over, we're going to actually learn how to protect each other by not showing up when we're sick. And there is a new study, as you mentioned, from China, which we have been talking about for a while, but it wasn't a double-blind, placebo-controlled. It was kind of a very quick makeshift study that talked about this drug, chloroquine and hydrochloroquine, which is a malaria drug. To this day, it doesn't really improve much. What it does is it increases, it makes the duration of the COVID maybe a day shorter. So we really don't know what's really going to happen. We also know that the problem with the drug is that it has side effects. And when you put it together with Z-Pak, which is the azithromycin that people have been doing it, you may have other side effects. So I think it's about staying clean, taking care of yourself now, and staying hydrated and not coming out of the house.
Okay, Dr. Campbell, anything you'd like to add?
You know, I think what we need to remember is COVID-19 really has 3 phases of disease. The first phase is when you get the symptoms perchance. You may have the cough, the fever, the body aches, the fatigue. The second phase is when you may get respiratory symptoms. The phase 3 is where you have this hyper-inflammatory, hyperimmune response, where your own body's immune system gets so revved up to attack this virus that it begins to attack itself. And that's where we see the critically ill patients that are on ventilators that end up dying from the disease. One thing that is very promising is that it does appear that the new drugs like hydrochloroquine and also some other older drugs that are out there, like potentially Plaquenil and other inflammatory mediators, can blunt that hyperimmune response. So to be clear, this is not going to clear the virus. It's not going to cure the virus. It may mitigate the virus. It may keep you from going to that lethal phase 3. Or if you make it to phase 3, it may help get you over that phase 3. So I think we don't have great data, but it's something that I would try in those critically ill patients to either keep them off a ventilator or try to get them off a ventilator.
Yeah, Dr. Schwartz, let me ask you about this. We're all aware that there could be underlying conditions that contribute to the fatality rate. Does that include, by the way, when people get allergies this time of year because of the respiratory system being involved, or get a cold, that sort of thing?
Well, actually, what it serves is to confuse us. And everybody's afraid that they have corona. So the moment they start having allergies, they start getting the common cold, they start thinking that they have corona. And I think that a lot of testing is not being done. And as we know, the testing has been really remiss. So I think it's a matter of what was said before, which is when you get really sick is when you want to bring in anything like serious, like chloroquine, Plaquenil is hydrochloroquine. Anyway, the point is that you shouldn't be confused and worry about it. If you don't have a fever, if you're not exhausted, if you don't have a non-productive cough, and you don't really feel exhausted and the fever is very high, you don't have corona. You have allergies. Stay home. Hydrate. Hydrate with alkaline water. Make your water alkaline with baking soda and water. You will actually decrease the inflammation and not go to the point of stage 3 when it's really too late.
Right. Dr. Campbell, how do you see this unfolding? Because I think a lot of people have their fingers crossed. We're going to get through this. It'll be okay. But then you hear the worst case scenario where maybe it'll go away a little bit, come back in the fall, be worse in the winter, and hopefully some treatments along the way, by the way. But how do you see it?
You know, unfortunately, I really see that we're not even to the worst of it yet. I think it has shown us that as our healthcare system in the United States is woefully unprepared for something like this. We have so many talented physicians and nurses and allied health professionals that are there ready to go, and we can't even give them the appropriate personal protective gear. If I had to guess right now, I would say, and I'm probably on the high end, that we're looking at millions of cases in the U.S., 2 to 5 million cases, and I would guess somewhere between 200 and 500,000 deaths. Yeah. Unless we can do something quickly. As far as vaccinations, we're talking 12 to 18 months out for the most part. There is some hope or convalescent serum, meaning that if I had it and made antibodies to it, I can donate my plasma to a person who is ill, and that might help them fight off the disease. So I cannot stress enough, as my colleague here has all done already, stay at home, make sure that if you're sick, you don't go out at all. Make sure you protect yourself and others, because if we do not do this, it could be catastrophic for our country from a healthcare perspective.
Very quickly, Dr. Schwartz, go ahead, very quickly.
You know what? 1 second. We need to do the testing, and we need to do actually the immune, what Dr. Campbell just said. We need to find out who's immune. And those of us who are immune, who have had immunity, there are a lot of possibilities. Those people can go out, can work, can protect the others. Yeah. And we're not doing anything for that testing.
Yeah. When does that testing come around? I've got about 10 seconds. Do you know when we actually get that test?
Mount Sinai has it, and they're not sharing it with us. We need that testing for everyone.
Okay. Again, our fingers crossed that will be the case. Dr. Campbell and Dr. Schwartz, thank you so much for joining us.